Good evening, everyone. My name's Aaliyah, and I'm your new host for today. I'm here with Cicely, our clinical associate in psychology, and we're here doing a mental health special for you today. So I'm going to allow you, Cicely, to introduce yourself and let everybody know what you do and how you got into the role that you currently do.
Okay. Hi guys, my name is Cicely, and I'm currently, like Aaliyah said, I'm a clinical associate in psychology. I also do a master's degree at UCO as well, and I'm studying adult clinicals like mental health as well. How I got into what I was doing, I think it all stems from uni. So I did a placement, and I did it within like clinical psychology, and I worked with young people with mental health, and I just saw the sort of lifestyle they were sort of living, and I was thinking, like, wow, I didn't even know that half these students had mental health issues, and I was sort of sitting in the same lecture as them. But then to be sort of someone that was now like a therapist to them, I saw like a whole different sort of lifestyle that I didn't know, I didn't really know or didn't know like existed. But yeah, I think that's how I got into it. So I think my placement really helped me to understand mental health a lot more, because obviously when you do it in uni, it's just like sort of the theoretical work with the, okay, this is what depression is, this is what schizophrenia is, but actually going into placement helped me with practical knowledge behind mental health.
Yeah. Okay, amazing. And can you just explain to us what a normal day-to-day looks like for you?
So a normal day-to-day for me, I think typically you just have your sort of meetings at work. You sit in sort of like an office space, you discuss the different patients that you have. So we would go through who has been seen, like a different patient, who we need to focus more of our attention on, and who might be coming into the surgery. I think since COVID, a lot of things have changed because we don't really have people that would come in as much. It would be more Zoom calls or just maybe a telephone conversation, but typically it would be involve me sort of sitting with like young people or younger people with sort of a mental illness, and just advising them or helping them sort of control their mind. So if I'm to compare it to my previous role, that was a lot more hectic. That was more of me sort of on a ward doing 12-hour shifts day in, day out, and sometimes they would just call you and be like, oh yeah, we're low in staff, can you just please come in? And so then you would sort of end up doing maybe 4 12-hour shifts within that week. With that, I think that was a lot more chaotic. You would sort of see, and it feels like you live with them, because 12 hours is actually like half of the day, and you're just thinking like this sort of lifestyle that they're sort of going into is sort of very routine. But I'll say back then it was very hectic. My role right now is a lot more calmer because it's within the community. These are people who are struggling probably at home, but haven't hit the sort of stage of having to go into like a ward, which is a lot more better than like going into the ward is just probably the highest sort of level of it. But yeah.
Okay, so you've touched a little bit on the kind of process it takes, because I know there's the community teams, and then there's the teams where in hospital, that's sort of when they're in their acute stages, so when they're actually going through episodes. So can you kind of explain to those who don't know sort of where you fit into that, and what would happen if the work you're doing, they would need to be escalated?
So there's 2 different systems like you explained. So on the ward is completely different. So at that point, you would have had to been where I worked, which was a forensic psychiatric ward. You would have had to been sectioned. Do you want to explain that? So
some people don't really have a clinical background, even though we may understand. Just explain, 1, what's a forensic ward, and 2, what it means to be sectioned.
Okay, so a forensic psychiatric ward is basically, let's say if a person was supposed to sort of, they committed a crime and they were supposed to be sort of in jail, because they have mental health issues, you would put them in a psychiatric ward instead of putting them in prison, because that won't benefit them. A sectioning, that normally is if like a professional, so it can be a doctor, social worker, or like someone that works within the Mental Health Act, if they decide or they sort of evaluate you and they look at you and they see that, okay, you need to sort of spend some time in like a mental institution, then you would get sectioned. Of course, there's like loads of different sectionings, but typically what we normally saw on our ward was like a section 3, which would mean that you would have to stay in hospital for about, I think it was about 6 months, and then that would be re-evaluated as well. So you would look at, within 6 months time, they would have some sort of like a tribunal or something, which is basically your lawyer would come and say, okay, yeah, you've got good behaviour, it's time for you to come out. But if your doctor still disagrees with that, you would have to stay until they believe that you were you weren't a threat to yourself or to the community. But yeah, so that's one section of it. And then now I work within the community, which basically is like an outpatient. So that's when somebody who's struggling with their mental health will come in and sort of see professionals and then go back to their home. I would say for me right now, my role within when I was working within the ward was more of like a carer sort of role. So it felt like I said, it feels as if you live with them. So you sort of wake them up, have medication, they go back to bed, then you wake them up for, let's say, lunch, they have lunch, then they go back to bed again. So it's very routine, and then you sort of see their outbursts. So the difference within that would be in community, I don't see when you've had, like, when you're at your lowest. So if you're really bad in your mood, I wouldn't see that because you only come in for an hour to have a psychology session with me. Whereas on the ward, it's 12 hours. Within that time, I'll probably see someone who's had an outburst, or let's say their interaction with another patient on the ward might be very, like, I don't know, someone might have, so you would see maybe someone getting secluded, or someone being restrained because of sort of like they've become agitated, or their mental health is playing up again. So my role within those two different places varied, I guess. So I think on the ward it was a lot more hands-on and making sure that they're okay, because it's literally 12 hours. Whereas in the community, I feel like I'm a lot more independent. So like I have my caseload. Currently it's just one person. So she comes in on a Monday, let's say, and we'll sort of have a meeting one-to-one for an hour, which is a psychology session, sort of go through the different techniques to see what's best for her. And normally they're given like sessions, because as you guys know, the waiting list is ridiculous in this country in terms of like getting psychology help. So she comes in and then she goes, and then I sort of make notes and then sort of plan towards the next session. So you can tell that those two different settings are completely different, and my role differs in both of them. But yeah.
So do you prefer any one of those settings, or is it just whatever your hands are led to do, you just like to do?
I think it's difficult because on community side is a lot less work. Like you're a lot more, like it's not too much for me in the sense that on a ward it's not one patient. It can be 12, it can be 15, it can be 6 patients. Whereas for me now it's like it's one patient that I sort of have to handle. I would say, of course, like in terms of tiredness, I prefer community, but in terms of actually understanding a person, I would say the ward is a lot better. So I think even in that context, you would see like some psychologists that will come in just to have sessions, but they wouldn't really have the same sort of understanding as a person that worked on the ward, like a social therapist, which was my previous role, where you sort of felt like you sort of live with them. So you come in at 7 a.m, you finish at 8 p.m, and then it's like you sort of see everything, and then there's night shifts, so when they're asleep you still have to sort of take care of them. So me personally, I would say I prefer community in terms of if I'm to be selfish and say for me, but in terms of getting to know patients, I would say the ward is a lot more better. But yeah.
Okay, perfect. So as you guys have noticed, I'm not only with Cicely, I'm with Mary. So I'm going to allow Mary to introduce herself, and then the main aim of today is we're both just going to go back and forth, asking Cicely here some questions, and then we'll give a chance for you guys to send in some questions also. So if you'd like to start sending in your questions now, and then we'll read through them. So Mary?
So hi everybody, as you know, my name is Mary, and if you don't know, if you're just watching for the first time, my name is Mary. I'm also part of the House of Medics, and I am a therapeutic radiographer. But today we're talking about everything to do with mental health. So my question to you, Cicely, would be about healthcare professionals. How do we prevent ourselves from burning out? Obviously, we do a lot about caring for, our patients. We are asked to do all these crazy shifts, and sometimes you almost don't want to say no because you want to. We do this job because we love it. We love to take care of our patients, and sometimes you might say a really interesting case that you're physically tired, but because it's an interesting case, you still take it on and you do it. You ignore yourself. We kind of really do put ourselves on the back burner, don't we? So what are the practical tips that you feel like healthcare professionals could do to use to avoid burning out?
I think for me, what I would say is, especially looking at the COVID period that has sort of dying off, but the beginning of COVID, I remember just sort of looking at like my team and just seeing that everybody is extremely exhausted, and then there's a lot of fear as well. I'll say my main tip is to obviously, I would say, listen to your body. So sometimes like you will be able to tell from just like yourself in terms of how tired you are, how maybe slowed down you are. You'll see that you start making a lot of more mistakes when you're burnt out. Now if you make mistakes, that's not really beneficial to patients either, because what we do is very important. The wrong sort of medication can just go completely left. So I would say literally listen to your body. If your body is saying it's time to rest, don't be afraid to say no to your manager if you know you've worked the hours that you've been allocated. And obviously a lot of them would like to, we all know there's a lot of strain in the NHS, but there's also a lot of bank staff members as well. So I would say take the necessary rest, utilize your annual leave. The annual leave is there to be used. Even if you take one day and say, okay, I'm just gonna make this like a self-care day, let me just sit at home, do absolutely nothing and just give my mind a rest, then you'll notice that you're doing a lot more better. I think one thing that I always think about is my mind. So I feel like if my mind is literally on overdrive, then my body automatically will end up being on overdrive. So during the COVID period, when I was working consistently, I think I noticed that I just wasn't happy, and in turn that just when I go to work, I'm just going to project that on my patients, or I'm going to project it on my team members. So it's best to just tell your manager, I know I've got let's say 3 shifts and I've done my 3 shifts, and even if you can't do the 3 shifts, if you're struggling, it's better to actually just speak out and be okay, this is currently where I am at. I don't think me coming into work is beneficial to patients. It's not beneficial to the team either. Therefore, whatever they can help you with, because there's actually stuff out there. I feel professionals just need to talk and not feel sort of guilty about taking work off because they know it's very busy. But I would say just sort of prioritize yourself, because if you're not able to perform at your highest, your patients will literally suffer.
You put them at risk. Exactly. Perfect.
There's a follow-up question on YouTube. So what's the best thing to do when you feel burnout but can't actually rest?
I would say the best thing would be maybe speak out. So if you can't actually rest, let's say you sort of agreed to, I don't know, the whole week you're going to do night shifts, because I remember there was a time I was in back-to-back night shifts, I think 4 shifts, just back-to-back. But I really agreed on it, so it's that's sort of my responsibility now. But what I could have done in that period is sort of talk to my manager and sort of be hey, this is a lot for me. So even if it means that I do have to come to work, there can be other things that you can do. So for my ward, I think there was times where you have people that are on computers and then you have people that actually run around on the ward. So if you communicate that with your manager and you sort of say, okay, at the moment I just feel very out of place, or I'm very burnt out. If they're not willing to sort of give you that time off, they can find something that's a lot more easier for you to do. But you're still productive, or you're still beneficial to the team. So I think if you know that you can't actually rest, still speak out and speak to someone, because you never know what they can actually help with in terms of something a lot more simpler for you to do.
Okay.
So what do you think, if you don't mind me asking, what is the hardest part of working in a mental health ward at all?
I think the hardest for me is having the wrong team. Like if the team is, sometimes I'll come to like my old job, I'll go to work here and I'll guys, I'll look at spinning
before
the team.
you enter the door.
I'll look at the team and I'm thinking, oh, like no, because you always have. If you have a team that's not willing to pull their weight,
it's very long. You're looking at the hours like
very, very long.
Because you have to do more than what your job title is. So it's like you're covering for the people that don't. Yeah.
So sometimes I can come in and I'm looking and I'm thinking, oh no. So I think for me on my like that ward, it was a lot of aunties, like a lot of older people. So being the younger person on the team, it was difficult because it's like they sort of see you as their niece, like you know that auntie vibe. So
they respect you though.
I think there were some people, some people that would respect and know like boundaries. But then there are others that, because maybe they're on a higher level as well, it becomes, oh, Cicely, can you take this patient out on like leave? Can you do this? Can you do that? You're thinking, hey, if I've done 3 back-to-back shifts and I don't want to go on leave with a patient, like automatically, if this patient wants to run away,
I don't have
energy to stop you. Like I'll let you run, if that makes sense. But I would say that's for me is the major thing, having the correct team around you. If everyone's willing to sort of pull their weight, you realize that the shift literally flies by. But when you clock a team that's just going to sort of, you just know you're going to be the one person doing everything. You just know that the whole day is about to drag. But I think my answer would be the team.
And have you had any sort of like interesting experience with like patients, obviously not naming their name, that has made you feel like, oh my gosh, what kind of day have I had? Like going home, like, you know, what experience have you had, like patient experience that you've had that's been like?
I've had quite a few. I've had incidents where, like, because their mental health has really just gone so bad, you can have like a random day, maybe the day before you and that patient got along, but the next day has come and they're completely just having a really bad day, and they're sort of just targeting you. So like, let's say if you're in the kitchen sort of trying to prepare something for them and they're outside the door and you're thinking, we need to sort of leave so I can come out, but then they become aggressive. So I think in time, I don't know, I would say for me, there's been, those days are very frequent on the wards because like, you don't know, firstly there's about maybe 15 people you might have to manage depending on the ward you're on. And that's 15 different mental health issues and different like people as well, like you said. So I think it was more about, I think every day was interesting. You never know, you'll have a quiet, fun day where everyone's like sort of in their room, minding sort of their own business, but days where everyone was sort of kicking off at the same time.
Okay, so can I ask, what actually motivates you to keep going? Because even from my experience, I've worked in a mental health hospital for a year, and I remember the ward they gave me was a male ward, and I was very new, and the week before they had given me that ward, one of the patients has actually grabbed one of my colleagues by the throat and held her to the wall. So you can imagine your head thinking...
What, by the actual throat?
Yeah, as in like the chain, as in...
Like the legs are dangling.
And you know, in mental health, the nurses are like half nurse, half security. So they're straight, like they've got to come on you. They're like, right, we've got to calm this patient down. If we have to give them medication, we're going to have to give them medication. We have to hold them down, sort of thing. So I know sometimes it can be quite tough. So what actually motivates you to keep going? What motivates you to think, okay, I'm going to keep coming in, I'm going to keep doing my role? Because I know it can be tough. For me, it was only 1 year, but for someone that's now going to be your profession long term, what is motivating you to stay within that?
I would say for me, what motivates me, I probably should have mentioned this at the beginning. I have a platform called Sound Minds UK, and I think that's my motivation because I just want to know, or I want to experience everything in mental health. Honestly, if I'm to say that I'm gonna just work let's say a professional sort of role for the rest of my, I don't see it. I don't see myself sort of just doing that for the rest of my life. I think I'll go on to set up something that will be so beneficial to young people, but this is sort of like the building process. This is sort of what I have to do in order to sort of experience all kind of sectors. So like I said, I started off with my placement, which was community, which meant I worked with people with eating disorders. So for me, I just see it as, okay, tick, I know, or I've worked with eating disorders. Then I've gone onto a ward, which is a forensic psychiatric ward. That's more, I think that was the scariest for me, because I was thinking, oh, like, I don't want to get assaulted, I don't want to go to hospital, I don't want anyone to bite me, but that's something that I feel like I've been able to do for a year and a half, and that's a tick as well. Then I've gone into community and sort of worked closely with a clinical psychologist, and I just want to get as much experience as I can get in order to sort of build my platform, which will then help young people. I think my aim realistically is young people. I don't see it being like older people, yes, but I feel like the older you have been in a mental sort of institution, the harder it is for you to sort of fix that mind, if that makes sense. I think once you get a person when they're young and sort of fresh, you can sort of train them to sort of deal with their minds better, because like I think at the end of it, everything to do with mental health is to do with a person's mind. It's to do with the way a person thinks, or the way a person interprets a situation, or just being attacked in your mind. So let's say if someone is seeing things, that doesn't just start with you waking up and seeing stuff. It starts off with, let's say there's a girl in my old workplace who was sexually abused. Now, I can say that I was sexually abused as well, but I had someone that I could speak to, so it made it completely different. Her own was she didn't have someone to speak to, so it's like
she suffered with that, and now she's holding on to a lot more hurt.
So it starts off with just that, and then it becomes loneliness, then it becomes depression, then it becomes nobody believes me, then it becomes anxiety. I'm afraid to go out because people are gonna target me. That develops into more depression, and then all of a sudden they can hear voices. Like it doesn't just start with, oh, I've just woken up and the voice came. I feel like there's steps to it. So for me, my motivation is I want to experience everything, get the knowledge that I need to get, and then sort of target young people so that they don't have to go through that system, because I think it's prison, if I'm honest. Like it's just a cycle, but
okay. I've got one here from YouTube, and it's following on from what you just mentioned. So it said, are there any places you would recommend for therapy, perhaps free or available to work around working hours? So I know you mentioned about you going through a situation that you was able to speak to someone about, and you feel that the mental health of others deteriorate if they keep it to themselves. So what's a way for somebody to reach out? And I'm not just talking about somebody in the public, I want to also say healthcare professionals, because I think sometimes we feel as healthcare professionals, I don't know about you, but it's harder for you because you want to reach out, but you know there's a certain like way you're looked at to sort of have the right mindset. So what would you recommend for someone that, you know, is going through something and needs to speak out?
I think what I would recommend is that I feel like in every sort of institution, like let's say at work, there's always like a sort of help line that's away from work, because I think nobody really wants to talk to their manager, because your manager's gonna start thinking, okay, you're unfit, you can't come to work.
And they'll look at you in a certain way.
I feel like a lot of like the way our system is, everything is very sort of, you don't know who's gonna say what. So I feel like those helplines behind, let's say the ward or behind where you actually work, is helpful, because they don't actually know you like that. And I think sometimes that's the best than having someone that knows you and you feel like they're going to judge you. I think it's better to have someone that doesn't exactly know you, but you can be open with, you can sort of express yourself with them and not feel a certain type of way. You don't feel like, you're looking at me, or you think I'm incompetent in terms of my job. So I feel like they should reach out. I feel like since COVID, places where you can sort of, I think they're called, my workplace is called like a mental well-being welfare sort of team, and they have like rooms where you can sort of go in, speak to someone, and it's not reported back to your manager, it's not reported back to any colleague, it's between you and that clinician. And I think that's very helpful, because sometimes like you can't even speak to, let's say, people at home, because maybe they're like, okay, yeah, just stop working, but they don't know that work is also helping in terms of your mental health.
Exactly.
So like being able to speak to them, they'll give you a professional advice without sort of judgment, and they're not going to like spill your information or like your business out there to your manager. So I'll say to that person or whoever, or I'll say to them, sort of seek out and look for those hubs, look for those mental well-being, welfare like sort of teams, and sort of speak to them about it. If you feel like that doesn't really help, then I think maybe speak to someone at home. And if you probably need a break, the NHS, they're actually quite understanding. They'll give you that break if that's needed. Yeah.
Okay, perfect.
Okay, so this week has been Mental Health Awareness Week, and I think we need to do more than just focusing on just talking about mental health this week as well. So my question is kind of a two-part question. So what can we do to raise awareness about mental health? It's just not 1 week. And then also, do you find that you have people more of colour that work within your field, and do you feel like people of colour kind of suffer more with mental health, and they do suffer from it in silence?
Yeah. I think what you said about it not just being a week is completely right. So for me, I don't really, not that I don't celebrate those weeks, but I don't make it too extra, because it should be something that's sort of spoken about every day. I think with mental health, it's going to take a while, just because of the stigma that was attached or is attached to mental health. I think even when you just mention mental health, people, oh no, I don't have mental health, and you're just thinking, hey, like mental health is either you have good mental health or you have bad mental health. It's not that you don't have mental health, you do. It's like having health, your health can be good or bad.
Yeah, exactly.
So I think it just comes down to us normalizing it and sort of speaking about it more. I think within the Black community, it's something that is avoided a lot more, but I do think we're starting to come out of that a little bit more, especially with COVID. I think COVID sort of opened up, let's say the government or like people up there, sort of opened up their eyes to mental health a lot more. They kind of understood, because there were a lot of people committing suicide during COVID, and that's because mental health really just went downwards for a lot of people. So I think with that is just breaking the stigma, sort of not allowing people with negative opinions to have a say about mental health, sort of having, we'll probably start from schools. We'll have to go into schools, teach young people so that it starts, they learn from it from early. So it's not that you're 20 and then all of a sudden you're confused as to why you're depressed. So I think it would have to start from like our institutions as well.
Perfect.
Okay, so I want to ask, what do you think is the most important thing when dealing with people with mental health? So that was a question that was sent in. I want to kind of expand with that, particularly as all three of us are healthcare professionals. What would you say is something that we can do if we see someone in our team, their mental health's deteriorating, or they're not quite, managing their tasks as they usually would do? As somebody who, I wouldn't say is a friend because we're colleagues, but how would you help that person if one, they don't want to reach out for help, and two, you can definitely see that it's impacting the way of their work, which again is going to impact obviously the team's work. So what would you do in that situation, number one, and number two, what do you think is the most important thing to think about or to do when you are dealing with someone with mental health?
So I'll answer the first bit. So I think the most important thing when dealing with a person with mental health is to actually listen. So it's probably something that's very sort of simple or basic, but
I think at the same time.
I think people think that I think people think that they're listening, but you're not. So just allow the person space to sort of speak and express themselves. I think that's, for me, is the most important. When I deal with my clients, I like it to be a situation where I'm very attentive to what they're saying. So I'll ask questions that will make you want to, not make you, but it will sort of force you to speak about how your week's been, what you didn't like, what you would have liked to change about your week. And I think one thing that people like to do, which is you like to avoid someone. So if let's say Aaliyah looks sad. Because I don't want to go through that whole conversation about, oh, why are you sad? And it takes a long time.
I will avoid be draining.
So you just avoid a situation when actually you could have helped someone by just saying,
wow,
like, oh, like.
So it's just taking that selfless act to ask the person, even if you don't really want to hear the sad story, try and have that empathy to hear it. Okay.
And for professionals, I would say it's a bit more tricky, because if you sort of, like you said, approach the person and they don't want to talk about it.
Sometimes they don't really see it though. Sometimes they think that is, it's not impacting them. So they think they're cooperating, but you can see that, honey, you're not doing what you need to be doing.
Or they're not ready to talk about it at that time.
That's true.
So I think with that, I don't know, but one thing that would be good is, like, you know how work teams have away days?
Okay.
Implementing more of those, but on the higher scale, if it gets to a point where it's impacting the team's work, it might have to be something that's addressed to sort of a manager who may be able to pick that up and sort of say, okay, let's have a sit down, and it's sort of like a meeting, so that at that point you'll be able to maybe evaluate yourself and think, like, for my manager to sit me down, there must be something going on. So it may be like, because, you know, if you're overworking, you just don't have the time to sort of see yourself. But I think that would be beneficial as well. But
okay, perfect. So I know earlier you mentioned about sound minds. So do you want to speak a bit more about what that is, what you do, and how, like, anybody watching can get involved?
Okay, so Sound Minds UK is a platform that we built, myself and my team built during the COVID period. So for a very long time I knew that I had to do something related to social media, but I think COVID really pushed me to do that, because at the end of the day it got to a point where everyone was just on social media because you can't go out. So in a nutshell, Sound Minds UK is basically a sort of platform to help and prevent young people from mental health. It's to help train a person's mind. So our biggest aim is to help people to sort of control their mind. I think, honestly, the mind is probably your biggest asset, like it's the biggest thing that you have. If you're not able to control your mind, that's something that can affect sort of a whole person's lifestyle. So if I have a mentality where everyone's opinion gets to me, I'm already fearful to make moves that I need to make moves on. And that's like, if you now use medical terms, that's someone that's a bit anxious, they've got anxiety, or if I'm someone that I'm always down and my feelings always get in the way of me doing stuff, someone will now say, like a medical professional would say, that's depression. However, I want it to be that we get to a point where young people are just very free with speaking about their emotions, their feelings, and they're able to sort of control their minds, they're able to train their minds to become the best sort of way, or the best sort of them that it can be. Our aim is to go into schools, so we're trying to set up sort of workshops and just target schools to teach young people about their mental health, to teach young people about how to deal with stuff, because I think one thing that this world sort of forgets to tell you is that there's going to be problems, like let's not get it twisted, you're going to go through things. That's not a bad thing, it's just about how you deal with those problems.
Exactly.
That's what makes somebody from being a patient to just living a normal life. It's just about learning how to sort of grab hold of your mind and train it and see, okay, there's a problem here, but I'm not going to allow this problem sort of to get to me. Sound Minds UK right now, we're just building right now to go into schools, and then eventually we want to be part of a school's curriculum. I think it will be something that will be beneficial.
Definitely.
I think it's something that people have started to try to implement in schools anyway, in terms of mental health in their, I think they're called PSHE lessons. And they talk about mental health, but I think I even had a teacher that DM'd me the other day, and she was basically asking if we came in to do workshops. And I was thinking, like, that means she's going through Instagram to sort of search for resources for her students.
So they're struggling.
So there's actually a need out there. So that's where we come in. We want to come in, fill in that gap, help young people actually take hold of their minds and just sort of better their lives. And then obviously long-term goals, entering into businesses as well. I think for a business to be effective, or for anything to be effective, it's all about your mind. So about the productivity of a team. If one person's mind is not in place, that's the whole team sort of done. But yeah, we're really all about training a person's mind and just making sure that young people just have that control that they clearly are sort of missing, because there's just a lot of those words being thrown around in terms of suicides, depression and anxiety, and it just shows that the mind is sort of being neglected.
So it's just teaching them coping mechanisms and ways to actually deal with the situations they're going to face, rather than trying to avoid them. Perfect.
Interesting, lovely. So I was going to ask, I love the fact that you've spoken about, impacting and, speaking to children and going to schools. So where do you see the mental health industry going, and what are currently being offered to patients who are going through mental health issues that you think could be improved, or what other things are not being offered that you think that in future you'd really like to see?
I would say for the mental health industry right now, biggest issue is the waiting list. So I've had, let's say, patients that will come in and you can clearly see, like even on the phone, you can clearly hear that this person is actually struggling, but you'll hear like a clinical psychologist telling them, okay, like we were able to offer you some help, but however that help, there's a waiting list that's like 2 to 5 years long, and you're just thinking, wow, this person's going to be dead by 2 to 5 years, like that's just not going to work. So I think one thing that needs to be improved in the mental health industry, there needs to be a lot more finances, a lot more practitioners, clinicians, just within that field to actually help support people. In worst scenarios, we've had like sort of, let's say if someone lives in Wales, the quickest, let's say the earliest bed they have for them is in London. So that's someone that's sort of already struggling with their mental health, now having to relocate to another country, to another city, to take care of their mental health, whereas their family still lives in Wales. So I'll say the biggest thing that we need to target within the mental health industry is sort of the services. There's not many services out there that actually sort of deal with people, especially when a person has become to a point where they need a bed. So it's easy to give therapy in terms of, not easy, but there's still a waiting list, but for beds it's extremely hard, because a service like, let's say, Mind Charity might be able to offer help on the phone, but if someone has gone to a point where they're really like they just need to be hospitalized, there's not a bed available. So I would say there's more finances needs to be sort of fueled into the mental health industry. But
okay, I'm gonna hit us all now with a slight personal question. I want everyone to answer it. And I want everyone to kind of give an experience of a time where you felt, your mental health was deteriorating, or you kind of was in a situation where you were struggling, and what you did to overcome it. Because I know we spoke generically, but I know there's a lot of questions coming in about sort of coping and what to do. And I think it would be helpful for the watchers to actually see how we cope day to day, because we all have quite strenuous jobs. So do you want to start with Mary and go around?
I think it's important to understand that, like we said, there's that fine line between good mental health and bad mental health. So there are times where you can be stressed, you can start having, panic attacks, anxiety attacks as well, because of just the workload or the pressures of life as well. So I've definitely experienced a few like panic attacks or stressful day whereby it's really, affected me personally, or my mind is just constantly bogged down by the amount of work I have to do. So what I really do with that is that I take time, I kind of get a to-do list, prioritize all my work. I'm really, really big on self-care as well. So self-care is something that I really take very personal. So I stop everything I'm doing. I can go out, go and get my toes done, go and get my just my nails, something like that.
Toes.
Yeah, just my cute toes. And because the reason why I say that is because it's so important, because I know that when they're doing my feet, I really enjoy it, and also apart from that, every time I look at my feet, I know that they're cute. You can't see it, but I can see it, so I can tell you my toes are cute.
Her toes are cute.
I look at them, and it's sounds silly, but it just gives me that little bit of joy, that little bit of happiness, and it's just I find it's the little things that I do that makes me happy, and then I kind of go back into work bit by bit and kind of transition into it. But for me, it will always be self-care.
So it's just taking the time out to do something you enjoy, something that makes you happy.
Yeah.
Perfect.
I think for me, my craziest moment was probably like when I first started working on the ward, because I just didn't expect 12 hours and all of this stuff. I think the way I coped with it, I'm not gonna lie to you, I did have days where I did break down and I'd probably be crying and I'd be like, oh, this is like hell, like do I really want to do this?
Wow.
But I think what helped me was like the family that I had around me. So like my current home now, just being able to sort of speak to my mentor or speak to, let's say, friends and be like, oh, like I'm really discouraged right now, this is what I'm sort of going through, and then them sort of reminding you of why you're doing this, and just having, like Mary said, having those days where like a friend will hear that you're going through it and they'll be like, okay, let's just go out and eat, or let's just have a day where we just watch movies and just chill and just not think about work at all. But I think one thing that I did do really well is I don't take work home with me. I don't. That's one thing I don't like it. I don't take work with me, so no one can be like, oh yeah, just like send me an email when you get home. No, I'm not doing it. So I just separate it. Work is work, home is home. That's where I have fun. That's where I sort of socialize and make it family time. But I think what helped me was family and my friends.
Okay, perfect. For me, I agree with both Mary and Cicely. I sometimes get to a point where I'm so stressed out, there's so much to do. I find, particularly as I'm studying at the same time as working, particularly now in fact in exam time, I find it's hard to balance sort of revision with work, plus your night shifts and your day shifts, and you're kind of moving around. So I would say for me, it is also just like, I would agree the same, just taking that time to do what you like to do. But also, if you don't have the time for that, because sometimes there is that kind of crunch time where you have exams and you do need to study a bit more than usual. So I would say support system, definitely have a great support system. There has to be someone that you can reach out to, someone that you can talk to, even if you don't have 2 hours to go out and do something. There has to be someone that you just offload to, whether it's for 10 minutes, just that phone call that says, I've had a stressful day, this is what I've been through, and just that person to hear you, whether it's on the phone or face to face. I think being in the House of Medics really does help, because you, even though we're not in the same sort of profession, we are all healthcare professionals, so we understand each other. But even so, I can give my mum a ring, I can give my mentor a ring. There's always that person that you can speak to. So I would say, to add on to that support system, make sure there's somebody that you can reach out to. Okay, perfect. So I want to actually round up with something for the audience. So we are doing a House of Medics giveaway. So we've got a Leonova tablet and some stationery for students who are currently studying, and I'll tell you how you can actually win all of these things. So the giveaway rules are, you must subscribe to our YouTube channel and leave a comment on a video of your choice. So just have a look at our YouTube channel. Not only is there this video, we do lives every 2 weeks, so pick one, just watch it and leave a comment, subscribe. Then follow either our Instagram or Twitter, because I know some people will either have one or the other. If you have both, that's great. Go on both, but if you only have one, follow our Instagram or our Twitter, tag 3 friends, and then repost our story or retweet with the hashtag House of Medics giveaway. So we've uploaded a video on both platforms, Twitter and YouTube, of the giveaway. We have the Leonova tablet and the stationery with it. So just retweet, tag 3 friends, subscribe to our YouTube and one of our other social media platforms, and you'll be in the chance to win it. So before we close, I want us to all give our social media platforms, but also, Mary, I want you to slightly touch on cancer education. I know we've done the Meet Mary already, but for those watching for the first time, I think that's been something that's really helpful in this time where we've spoken about mental health. So I want you to just tell them briefly what you did because I think it really impacted positively on the mental health of people that are going through cancer therapy.
Yeah. So last week we did what we call Vision 100, and it was basically we gave over 1,000 support packs to 6 major hospitals in London, and in those support packs were like healthy snacks, healthy drinks, facial stuff, but most importantly there were colouring therapies for people. Research does show that quite a lot of people do find colouring and very helpful, especially, and it helps relieve them of any stress. And most importantly, we had a thinking of you card, just to let people know that even though they can't bring friends and family to the appointment while they're having treatment for cancer, but there are people who are thinking of them. They're not alone, and I think, like you rightly said, it does just brightens people's day up. It makes people smile, and to know that it's just a little pick me up, something just nice to say that you're not alone in this, and so that people are positive and happy again, just for that little moment as well.
Lovely.
But yeah, I'm just going to quickly ask you, Cicely. So, are there any anonymous places whereby people can go and ask questions? And also, just as a final question, like, what would you want people to remember about their mental health, or what are the tips that they should have in mind when it comes to mental health?
So first bit of the question, places for people to sort of go and speak without people knowing who they are. There are quite a few helplines. So we have the crisis line, where you can call and sort of speak to someone who doesn't know you at all, and sort of explain to them what you're going through. There's a lot of them. There's Ask as well. There's the Mental Health Foundation sort of helpline, safeguarding helpline. There's quite a lot on there. A lot of it is just by sort of searching on the internet. And just calling the closest place sort of to you. And the last question that you asked, the last bit of the question, I would say the one thing that I would want people to remember about their mental health is just always sort of look out for your mind. So if you can feel like that your mind is overthinking or is doing a lot like within a day, it's probably a sign that you need to sort of take care of your mental health. So you have those days where you're like overthinking and you're sort of exaggerating sort of every situation. Those are like the days that you probably...
Alright. Sorry, she's very shady.
No.
We all have it. We all have it.
Trust me, we all do.
A little bit of drama and all. It's okay. Sorry.
Yeah, we all have it, like they said. But that's like a sign for you to sort of say, okay, I need to take some time out because what she did or whatever person did wasn't actually that deep. So I would say that's the advice. Sort of look out for your mind, look out for those signs, and don't be afraid to speak out. Like, just do it. Yeah.
Perfect.
Alrighty. So, if you'd like to start as our lovely guest, just tell us your social media and about social media.
Sound Minds as well. Plug both, honey.
Okay. So I'm probably just gonna plug Sound Minds because I can't even remember my personal handle. But Sound Minds is on Instagram. We're at Sound Minds UK _. On TikTok, we're just Sound Minds UK. And on YouTube, we're just Sound Minds UK as well. But yeah, and maybe if you can find me, it'll probably be Cicely, and then maybe just type mental health and it'll come up. But yeah, just follow the Sound Minds UK account. You'll be able to find me from there. But yeah.
Perfect.
And I am MISS Oladele, OLADELE. That's me.
Okay, and I am Miss Elia _. That's Miss with a M for mother, S for sugar, ALIYAH _. And that's on Instagram, Twitter, Facebook. I'm just Elia Gordon, and everything else will be there. But thank you guys for tuning in. We hope this was really useful. If you have any questions or comments that you want to leave below, or head over to our Instagram. We'll be happy to answer any DMs on there. But thank you for joining. Stay tuned.
Bye.